The average menstrual cycle lasts about 28 days, although cycles between 21 and 35 days are considered normal. Phase 1. Menstruation and follicular phase, days 0 to 13. The cycle begins with menstruation, also known as the period. This is when the uterine lining sheds, resulting in bleeding. Why does this happen? Because pregnancy did not occur in the previous cycle, hormone levels, particularly estrogen and progesterone, fall. This hormonal drop triggers the breakdown of the endometrial lining. At the same time, the brain begins preparing for a new cycle. The hypothalamus releases GnRH, gonadotropin-releasing hormone, in pulses. GnRH stimulates the pituitary gland to release FSH, or follicle-stimulating hormone. FSH acts on the ovaries, promoting the growth of several ovarian follicles. Each follicle contains an immature egg. As follicles grow, they begin producing estrogen. Estrogen has important effects. It rebuilds and thickens the uterine lining. This is called the proliferative phase. Endometrial glands become straight and narrow. Cervical mucus becomes thin and stretchy, helping sperm movement. By the late follicular phase, one follicle becomes dominant. This dominant follicle continues enlarging and produces increasing amounts of estrogen. Phase 2. Ovulation, around day 14. When estrogen levels reach a critical peak, something fascinating happens. Instead of suppressing hormones, high estrogen now causes positive feedback on the pituitary gland. This triggers a sudden LH surge, luteinizing hormone surge. The LH surge is the key event that causes rupture of the dominant follicle, release of a mature egg from the ovary. This process is called ovulation. The released egg travels into the fallopian tube, where fertilization may occur. Meanwhile, the ruptured follicle transforms into a new structure known as the corpus luteum. Phase 3. Luteal phase, days 15 to 28. The corpus luteum now becomes hormonally active. It produces progesterone, the dominant hormone of this phase, smaller amounts of estrogen. Progesterone prepares the uterus for possible implantation. It causes thickening of the endometrium, development of tortuous, coiled glands, increased secretions, called the secretory phase. The uterine lining is now rich, vascular, and ready to support a pregnancy. What if fertilization occurs? If the egg is fertilized and implantation happens, the developing embryo produces HCG, human chorionic gonadotropin. HCG maintains the corpus luteum, allowing continued progesterone production. This sustains the pregnancy. What if fertilization does not occur? Without fertilization, the corpus luteum survives only about 10 to 14 days. It then degenerates. As it regresses, progesterone levels fall. Estrogen levels fall. The uterine lining loses hormonal support. This leads to shedding of the endometrium. Menstruation begins again. Additionally, with falling estrogen and progesterone, the negative feedback on FSH is removed. FSH levels rise, and a new cycle starts.